Hey guys, it's Reagan and Rochelle again, and this week we have something real important to talk to you about, real serious, brain injuries.
Yeah, it's a very serious topic, right?
Yeah, so what to do, where to go, Rochelle, tell them.
Yeah, it's really important to know when you should go and where you should go if you suspect any type of a brain injury. And anytime you do suspect a brain injury, the important thing to do is go straight to your local ER, your nearest ER for treatment immediately.
That's right, Rochelle, it's all about quick response. So anyway,
Absolutely.
guys, hang around, we got some tips for you. All right, Rochelle, you need to know that TBI stands for Traumatic Brain Injuries. All right, Rochelle, so we told everybody what TBI stands for, but let's tell them a little bit more information so they'll understand everything. Go ahead.
Okay, sure, Reagan. It's important to understand that TBI, traumatic brain injury, as we previously said, results in about 2.8 million ER visits a year. It can be TBI or any type of injury, and about 153 people die each day in the U.S. from any type of injury. It can include traumatic brain injury or any other type of injury. So it's very important to know that. The other thing is that the medical community is very concerned about TBI because about 30% of all injuries result in death. The other thing to know is when do you have a TBI or what causes a TBI? As you may have guessed, Reagan, a traumatic brain injury can result from a bump, a bolt, or a jolt to the head. Not all head injuries result in TBI, but TBIs can result in abnormal functioning of the brain. It has a disruption in the brain. So it's very important if you think you suffered a serious blow, a bump, or a jolt to the head, that you seek medical attention immediately and you go to your nearest Altus emergency centers. Traumatic brain injuries range from mild to severe, mild presenting with a brief loss of consciousness or memory loss, and severe they can be unconscious for extended periods of time. The most common form of TBI is known as concussions. However, even if they're mild to severe, you want to seek medical attention immediately. Even concussions need to be treated and seen.
That's right, Rochelle. Recently we had Josie, if you saw our recent video about her.
Yeah, Reagan, you did a wonderful job on that video.
Well, thank you.
So many compliments about how sincere it was and how wonderful the story was and the outcome was for sweet little Josie.
That's right, yeah. If her mom, Jennifer, wouldn't have brought her in quickly as she did, things would have ended up way worse. So time is everything.
It's of the essence.
That's
Absolutely.
right. You got to get to your nearest Altus ER quick.
Keep in mind that all traumatic brain injuries, if there's a suspicion of a traumatic brain injury or a head injury, the most common form of diagnostics is CAT scans.
That's right.
And so emergency rooms, your local Altus emergency rooms have CAT scans available to run the diagnostics or the CAT scan on the patient to make sure that there's not something severe going on in the brain. Remember, your physician's office won't have that. They'll have to refer you to have that done. So again, time is of the essence. We want to make sure you're seen and treated and proper medical attention is given immediately to any type of head injury.
Right. We were able to get Josie a flight out of here she had to go right into immediate surgery when she got to Houston at the Children's Hospital.
Yes.
So timing is everything, and they're not going to be able to have a helicopter land and pick you up there. So
Reagan, can you list a couple of reasons why they should seek medical attention when they suffer a head injury?
Yeah, Rochelle, so there's a few things you want to look out for, and it's kind of broad because there's so many different injuries you can get with the brain, but things you want to look out for is headaches, headaches that won't go away as well. If they're confused and can't remember anything, they're forgetting. And also another big one is nausea and vomiting. If they're nauseated and vomiting, that's a real big flag.
And in addition to that, you want to watch out for confusion, unable to have regular speech. They have slurred speech. If they're beginning to experience seizures, if they're not able to be easily awoken after a head injury, you want to watch for that. And the last thing you want to be sure to watch for is if they have any discharge of clear fluids or blood from the nose or the ears, it's definitely a sign to seek medical attention immediately.
That's right.
Okay.
All right, guys, like I said, all brain injuries are serious and they should be treated as such. The thing is, like I said, time is of the essence, and I can't tell you that enough. It is so serious. You've got to get to your nearest Altus ER. You got to get it checked out because serious complications can occur from this, and it can go from this to extreme really quick and really fast. So your best bet is getting to the ER, getting the CAT scan, making sure that you're okay. Your peace of mind, I'd rather find out that I was okay than something to happen worse.
Delay treatment.
That's right. And it may not be you. You may see somebody with a traumatic brain injury that needs help, and you need to get them there and get them the help they need.
Absolutely. So just be aware of the signs and symptoms, and just know that every head injury can, as Reagan said, go from small to large very quickly, and you want to be sure that they're evaluated by the medical professionals.
Right. Your peace of mind is the most important thing.
Absolutely.
And just like with Josie, if her mom wouldn't have brought her here, things would have escalated and ended up really bad. So you always need to go to the ER and get checked out to be safe.
Definitely. definitely. And we're so grateful for Jennifer and Josie for that they're all okay today. So thank you for that testimony.
And as always, guys, me and Rochelle are so thankful you're watching these videos. It really means a lot to us. All your likes, comments, suggestions, and your shares, that really means a lot to us because we really love doing it.
If you have suggestions, please leave them below in the comments section and we can talk about them in the future.
That's right. And if you like this video, subscribe. You'll be alerted of our next video that we're doing each week. And we're doing multiple videos. We're trying
Yes, he keeps me in the studio all the time. I barely could do anything else because he's always saying, the next video, Rochelle, the next video.
That's right. That's right. And guys, we got the red couch you guys voted for. We'll have that here in a few days. So we're updating the studio. So lots of cool things are happening. So hang around. And guys, remember, we're more than neighbors. We're family.
family.
See you guys next week. Take care.